Hello everyone, my name is Steven and I am a first year dental student. I have this new microphone setup here, same microphone but different setup overall, so hopefully this sounds pretty nice and is a bit of an upgrade for the videos. I'm doing something a little bit different today, so I like to sometimes have fun on this channel. These videos for me are really a fun thing to do and a fun thing to put my extra time into. And so today, I, as a first year dental student, am going to be checking out the Reddit DentalSchool page and sort of just reacting to a couple of the posts and giving my thoughts to some of the things that people are talking about on this page. As a disclaimer, I'm not really a Reddit user. I don't use it all that often. I do go on here sometimes to help people out, answer a few questions here or there, and also to just ask a few questions whenever I'm having trouble with like my computer or my editing software, anything like that. I'm also not an expert on dental school. I am a first year dental student. I'm not super far into it, but I have learned a lot about the process of being accepted into dental school. And I think that I might have some interesting things to add to some of these posts. So let's not waste any more time. Let's go ahead and get right into r/DentalSchool and check out a couple of posts. Okay, so I've found a post that I want to start with here, and this one is talking about SurgiTel, which I am not familiar with, but this person is saying that they had a lot of trouble with a pair of loops and like ordering loops and getting them. And unfortunately, it seems like this person's experience has been really terrible and probably isn't getting a whole lot better. But I'm going to tell you out of experience right off the bat, go ahead and get oroscopic loops. You won't regret it. So next post here, this is asking about the best way to log shadowing hours. So I remember as an undergrad student, one of the big things that you do in order to be accepted in dental school is you do a bunch of shadowing and a bunch of service. And I remember thinking, I'm gonna have around 150 to 200 hours of each of these things by the time I apply. How am I going to sort of track this? And I think the old school way is to do it with Excel, but let me show you the way I would do it if I was doing it nowadays with Notion. So I've made a Notion page here, and all I'm gonna do is hit the / and then I'm gonna hit data, type in data I should say, and then I'm gonna find an inline table, and then you can name this whatever, shadowing, and then you could simply title this shadow experience, whatever you want there, and then go over here and click this and find number. We'll change the name to this as well. So let's say we shadowed with Dr. Ray here and we did 8 hours. Once we've added in the hour, we're going to come down here where it says calculate, hit this, and then hit sum. And that's going to give us a sum here at the bottom. So next day we shadowed Dr. Mike, and that is going, let's say we did 4 hours there, that's going to give us a sum. So this is a super simple way to track your hours, and you can add in all sorts of other information to this table if you want. Go ahead and just look into Notion databases. They're really helpful. So this person asked a question about biochemistry. They say, can I take the biochem before I go to dental school, but after graduation? Can I take biochem before going to dental school, biochem during the senior year, summer and dental school in the same year? So this is an interesting question, and I think this is a good question that you should ask your the admissions department of the schools that you're interested in. I know that you can be accepted into dental school without having completed all of your prereqs. It is common, it's not super common. A lot of times, especially with a course like biochem, they want to see how you did on that course in order to accept you. But this is just something that I would ask like your head of admissions or whoever you communicate with in order when you're going through the process of being accepted to see if you can, but this should be fine as long as you get it completed before dental school. And then if you're anything like me, you will take biochem in your first semester of dental school again, so it'll be pretty fresh, which actually could be quite helpful. So let's check out some help here. Hi, so I'm a grade 12 student going into uni, and I recently have grown an interest in being a dentist. Wonderful. But the issue is my track history in bio is terrible, but I don't mind putting in effort and time to get better. I was just wondering, is there anyone heard of a dentist who's struggling with bio in high school? I guess I'm just looking for reassurance if that's possible. Yes. Bio is tough, and just like all of the sciences, it's going to be a challenge. I was not a great biology student by any means. I think the best experience that I had in bio was microbiology. I actually really enjoyed that class. But to be a dentist, you don't have to be a great biologist or a great chemist. You just honestly have to get by. And this is sort of an unpopular opinion. If you talk to people in admissions department, they really want you to succeed, which is true. But ultimately, when you get to becoming a dentist, your ability to understand biology is not necessarily going to be super pertinent. But go ahead and try to do your best. Try to do the things that will allow you to get the best grades. And don't give up on dentistry because bio is hard for you. A lot of people that go to dental school struggle with bio and just have to get through it and get the best grade they possibly can. Look into tutoring, look at all of your YouTube resources and do it that way. And I promise the path to dental school is still there for you. So this person's asking about cheap dental schools. Interesting question. I'm making a list of schools planning to apply to, and I've been doing a lot of research on the cheapest. Interesting question. So obviously this is something you can look up. I'm pretty sure straight up online you can see the lists of the cheapest schools. And this is serious. I mean, paying for dental school is a serious issue, and a lot of people nowadays are actually having to choose other careers because dentistry is so expensive to get into. I know that my school where I'm at the University of Tennessee in Memphis. I get in-state tuition here, which is helpful, but it's still a ridiculous amount of money. And so definitely look into this. I think more and more these days, the cost of attendance is going to be one of the most important factors for people. So I don't blame you on this one. Okay, so I've read this post here, and this person is talking about how they've wanted to be a dentist, but they're just having sort of second thoughts as to whether or not they should go ahead and actually go through with it. They've had some rejections, which is making them think maybe this isn't for them. Now, I think this is extremely common, especially if you've sort of committed a bunch of time to it and you're not accepted on your first or second try. A lot of people, have to make that decision of whether or not it's worth it. Now, I'm going to be the biggest proponent of dentistry pretty much out of anybody you'll ever talk to. I think that dentistry is one of the best professions out there, but only if it's right for you. I don't think that everybody should be a dentist. Maybe that's something I should talk about in a future video. But if you do think that, based on your shadowing and your experience seeing dentistry, if you do think that you can see yourself doing it and you want to do it, I think that you should stop at absolutely nothing to do it. And I'm just such a fan of the profession. I'm so excited to enter it myself. And if I were this person, I would continue trying, but only if they've decided that it is truly what they want to do. It is a difficult course. It's difficult to become a dentist. It's difficult to go through the entire process, and it may not be worth it for everybody. So just weigh your options, but definitely become a dentist if you can. It's a great profession, I swear. Okay, so look at this one. So would you still want to be a dentist if you had 10 million, 100 million, or a billionaire? This is a great question. And it's, of course, it's not a very feasible question. It's highly unlikely that any of us are ever going to have this much money. But it is a good question that asks you whether or not you truly want to do this because of your love for it or another reason, and not for the money. We know that dentistry is a profession in which we can make a lot of money. We stand to make a good living. But the question is, would you do it if you had all of this money? I think this is funny. This person said no. And then there's 8 upvotes. I don't know. I think that, and I haven't done dentistry yet. I mean, I've experienced it a little bit. And from what I've experienced, I've really enjoyed. It's very difficult, and I'm sure adding live human patients into the mix makes it even more difficult. But the interesting question here is just, I think it gets down to, do you want to do it or not? For me, the answer is yes, 100% with my whole being. I want to be a dentist. That's why I'm at where I'm at. I don't see myself in this life doing any other job other than maybe making YouTube videos. But that's probably not something that is a full-time job for me. And so I guess the question is, if I had that much money, would I want to work at all? And honestly, in my life, I think that I would get pretty bored and I would feel pretty unfulfilled if I didn't work. And so if I had a lot of money like that, I probably wouldn't keep it all for myself, certainly. But I also do think that I would feel the urge to continue working. And I know that sounds really weird, and maybe I'll regret saying that in the future, but I think dentistry is what I want to be doing. And if I had that money, I would still feel like I needed to work. So my answer is probably going to be yes for this one. Okay, so this one is SimLab Clinic Advice MAD1 that just started fixed and operative. And per usual, I feel like I'm in over my head. My preps are trash, LOL. I'm not expecting them to be perfect after a month, but damn, they're rough. If you could go back and give yourself some advice, tips, tricks, what would it be? This is for SimLab or transitioning to clinic, thanks. So really interesting here. Obviously, I'm also a D1, so I can't act like I'm on some pedestal because I'm certainly not. But as of late, I really have been doing a lot better in my operative lab, and it's sort of just come with practice. But I also have one recommendation for you. Let me show you here the guy who's just like changed everything for me. Go to YouTube and type in Stevenson Dental. Type in Stevenson Dental Solutions, this guy right here, and just start watching some of these videos about how he does his preparations. And specifically, you know, just any sort of class 2. Some of them are composite, some are amalgam. But watch these videos and study these videos, and you'll see how he actually goes about cutting these preps. And I mean, it literally opened my eyes. And I realized that what I was doing in operative was garbage, and it was not at all what I needed to be doing. And so after watching these, I sort of have changed my approach to operative, and my preps are infinitely better. Don't get discouraged. We've been at this for a few months, and a lot of people, it takes many years for them to be proficient with a handpiece. I think nowadays we have great teachers and great technologies, and we're better prepared than generations before us. So don't give up. I know exactly how you feel. I've had actually multiple labs where I've gotten home and thought about crying. I was so upset, especially for upper preps. But yeah, watch these videos, study them. These videos made me actually enjoy operative a lot. So check these out, and I promise you'll get better with time. Don't give up right now. All right, so let's do one more here before I head out. This one is asking about community college, and it's saying, I am a senior in high school and I'm going to community college, want to get into dental school. Does going to a community college hurt my chances of getting in? And if it does, should I transfer ASAP? I'm in California. Also, any advice on what classes I should take my freshman year? I didn't go to community college, so I can't speak this for a fact. But if I had to guess, or if I had to give my educated opinion, I would say that going to community college doesn't matter. It really doesn't. The most important thing, and I've said this before on my channel, but the most important thing in getting into dental school is your grades and your DAT score. In fact, DAT is probably listed first there. Get the grades. If you go to a community college and you get straight A's in all of your science courses, and then you do well in the DAT, you're probably gonna get into dental school. So this idea that you have to go to a big prestigious university is sort of antiquated and doesn't really apply anymore. It may have applied at one point, it doesn't anymore. If you can perform these days on the DAT especially, and then also get straight A's, you're gonna get into most dental schools and pretty much any dental school that you could want to go to. I obviously don't know as much about the California dental schools. I'm down here in the South, but that is my advice to you. There's nothing wrong with community college. It's probably a more affordable option. Just make sure that you're having a good experience wherever you're at and you're getting good grades and preparing yourself to take the DAT, in which case you should be using DAT Bootcamp anyways, which is the best way to prep for the DAT. But that's pretty much my advice for that and for all of those other people that have been posting on this Reddit. I do like to check this out, and if you enjoyed this video, let me know and I'll do another one, just kind of checking out some of these posts and giving my responses and my thoughts to them. And also let me know what you think about the new mic setup. Hopefully this is like a nice way to talk at the desk, and it adds a little bit of value to the videos. But I appreciate every single one of you for watching. My name is Steven once again, and if you enjoyed this video, let me know in the comments. I love hearing from all of you. And I will, of course, see you in the next one. And now it's back to anatomy studying, because the studying never ends, folks, let me tell you.